Hi, I heard that you had some questions because your mom has osteoporosis. My name is Brittany Kelly and I'm a nurse practitioner here at Dr. Polcino's office. What are your concerns today?
Okay, what is osteoporosis?
So osteoporosis is a bone disease where your body either makes too little bone or is just not making bone anymore, or both. And the problem with this is that your bones can become weak and brittle and they can break.
What are some of the risk factors in osteoporosis?
So there are multiple risk factors for osteoporosis. One of them is age. So as you get older, you're more at risk. Another is sex. So women are more likely to have osteoporosis than men. Another is race. White women and Asian women are more likely to have osteoporosis. Another is family history. If your mom or your dad has it, you're more likely to have it.
Okay, when and how should my mom be tested for osteoporosis?
Okay, so you should be tested for osteoporosis typically every 2 years. When you would do that is when you're a woman over 65 or you're postmenopausal, meaning you're not getting your period anymore. And how you would get tested is something called a DEXA scan, which measures your bone density and also calculates your risk for fracture.
What are some of your symptoms of osteoporosis when you have it?
So actually, osteoporosis sometimes doesn't even have any symptoms. You don't even know you have it. But if there are symptoms, they can include a loss of your height, a stooped posture, back pain, maybe if you have a fracture, or if you fracture really easily over something that you wouldn't expect.
What are some of the treatment options my mom would have with osteoporosis?
Okay, so there are treatments and ways to try to prevent osteoporosis. So in order to try to prevent osteoporosis, what you should do throughout your life is to have an adequate intake of calcium. You should have vitamin D supplementation and then perform low weight-bearing exercises such as arm weights. Treatments, you should talk to your provider about this, of course, but there are certain medications available now, such as biphosphonates, that you could take to help stop the bone loss.
Thank you so much for all this information.
You're welcome. I'm glad we had this discussion today. If you have any questions, you can always call Dr. Polcino's office or send us an email.